All right. What's the deal with liposuction? Who needs it? Is it a waste of time? Is it a waste of money? Or is it actually a valuable treatment? Today, we've got Dr. Jessica Walker back on the show. She is going to walk through the ins, the outs, the pros, the cons of liposuction. Welcome to the Trillium Show. I'm Dr. Jason Hall, board-certified plastic surgeon, author of the new book, Art of Aging, which you can find down in the links below. And today I have the pleasure of sitting and talking with Dr. Jessica Walker, who has newly joined us at Trillium Plastic Surgery as of 6 months ago.
Yes.
And we are going to talk all things liposuction. So, Dr. Walker, welcome back.
Thank you for having me. I'm so happy to be here.
You did
not gonna lie, this is not my strong suit. I like social media.
But you did such a good job on the first show. We decided that we're going to redo it.
I can't believe that we did. I can't believe I did it.
A lot of people think liposuction essentially cures everything. It is the cure for any lumpy, bumpy, hangy problem that you have between your breasts and your knees. Is that really the truth?
No. You know, liposuction to me is a complement surgery. It complements the other surgery that you're having done. It is a contouring surgery. It is not a weight loss surgery. It's not going to make you lose weight. And a lot of times people come and they pinch their skin and they're like, look at all this fat. And I'm like, that's actually skin excess. It's hard to decipher being from the patient, what is fat versus excess skin. And then the other thing too is they think it'll help with cellulite, I think is the big one. Cellulite and skin excess, people think a lot of it is fat and it's really not. And that's what liposuction does, is it removes fat. It's like taking the stuffing out of a pillow. That's how I kind of use it as an analogy to patients. So if you have excess skin and you do liposuction, you can actually make that worse. So to me, it's a complement to other procedures that you're having done.
Like what?
So the classic thing that, I pretty much almost always do liposuction with is a tummy tuck. Mainly kind of the waistline area to help bring in that contouring. And then I have also started really doing a lot of liposuction mainly in the lower back in patients who are having a tummy tuck, because I think once you fix the front, you notice a lot more things kind of on your side and your back, mainly that love handle area. So I do a lot of liposuction, or what we call lipo 360, so the back and the front, with my tummy tucks is the biggest thing. But, we do liposuction complementary to breast surgery when people have excess fat kind of here on the sides. We do liposuction of the thighs. We do liposuction in the chin or the submental area. So it's kind of used a little bit everywhere.
Is it something, you said it was complementary, but can't you just kind of do it by itself?
I would say it's much more rare to do it by itself. Yes, there are definitely cases where you can do lipo 360. Those are going to be your younger patients who have much younger skin. Unfortunately, our collagen and elastin peaks around age 30. So kind of after age 30, you're going to start getting skin laxity. And that's when we kind of need to start thinking about tummy tuck, mini tummy tuck, skin excision procedures, along with doing the lipo procedures. And especially if you've had kids. If you've had kids, majority of the time you are going to need a tummy tuck because you need those muscles fixed. So lipo, or what we call lipo 360, just doing liposuction, I would say is more the rarity, but it definitely can happen. It's usually younger patients who I know their skin is going to contract down.
What about arms and legs? Because you hear, and our office gets phone calls all the time for people wanting liposuction just of their arms and legs. Mm-hmm. Can you use it for those areas? If not, if you can't just use it for your abdomen and trunk?
So kind of the same thing. I would say the majority of the patients that we see in our office are 30s to 40s. We kind of get the extraneous like into the 20s and more like 50s, 60s for body contouring. And most of those people are done having kids or they are weight loss patients. And at that point, we're probably talking about skin removal surgery along with doing liposuction. Again, yes, liposuction can be done alone on the arms and thighs, but it's in select patients who we can try to predict that their skin is going to contract down and not be loose after surgery.
So it sounds like what you're saying is that the skin is really the biggest issue with liposuction, not the fat. Am I hearing that right?
Yeah. And now that you word it that way, yes, it's more of, we can take the fat out, but if the skin's not going to contract and look nice, it's not going to be a nice result. The other thing too with liposuction is, it can create contour regularities. It can create lumpy bumpiness. So you have to pick it on the right patient if you're going to do liposuction alone.
Is there any way for somebody who's listening to this at home and like me, when you were sitting here talking, I'm like sitting here pinching around my midsection. Is there any way that people can tell if their skin's going to be good enough beforehand so they don't come in to see you and think that they're going to get liposuction and you say, well, actually, you're going to need a tummy tuck and a thigh lift?
It's really going to depend on physical exam. We were just talking about this, patients call and they want a specific thing, but until we examine them, we can't make that recommendation. So at home, if you're pinching the skin and you can create a roll and pinch it between your fingers, if you have stretch marks, if you're a massive weight loss patient, if you've had pregnancies and kind of really getting into like the late 30s age-wise and past that where we know the collagen and elastin isn't great, you're probably looking at a skin procedure along with liposuction.
Does that same thing hold true with patients who have been taking the GLP-1s, the Ozempics, the Mounjaros, and all of this other stuff?
Same thing, depending on how much weight they've lost. A lot of them coming in have lost 50 or more pounds, which, massive weight loss is usually close to 100 pounds, but some people have lost 100 pounds. But for me, if you've even lost over 50 pounds, the biggest thing with weight loss and the massive weight loss population, as well as the injectables now, is that you're losing weight quickly. So when you lose weight quickly, it's great, it's wonderful, but your skin does not have time to contract down at the same capacity. So that's where we're seeing skin excess in these injectable patients as well.
When patients have that extra skin, liposuction is just going to make that worse. That's kind of what you're
It can,
saying.
yes. Mm-hmm.
Yeah. How does liposuction differ from some of these non-invasive things that you hear so much about? The CoolSculpting, the M-Sculpt, all of these other devices that are, popular on the internet and on billboards all over town.
So those CoolSculpting doesn't work. I'm just going to come out and say that. I'll be frank about that. It doesn't work. We actually, we thought it was going to be this great technology, but we are actually seeing sometimes the opposite effect, something called PAH, or paradoxical adipose hypertrophy, which is paradoxical obviously means the opposite. Adipose is fat and hypertrophy means to get bigger. So I've had patients come in and they said, I did CoolSculpting and I actually feel like I gained weight, and that absolutely happens. The tough part on the surgery side is that it kind of makes the fat a little bit more fibrotic, so it's harder to treat with just liposuction. CoolSculpting, unfortunately, is not what we were hoping it would be. With the other procedures, I think they're more geared towards skin tightening. And I think that they will give some effect, but a minimal effect. Nothing's going to give you the tightness of what a surgery is going to give you, no matter how great the technology is. It's just, if you need skin resection, you need skin resection.
So then who would be your ideal candidate for, say, liposuction on its own?
Usually a younger patient, someone who hasn't had children yet, who has a BMI, usually 25 or less, not overweight, not obese. So they have a good weight, and you're really just doing it for contouring. Because, patients who have more fat deposits, even though we lipo and take it out, their skin's not going to contract. It's going to be loose skin. So it's really contouring a younger patient. We know their skin's going to contract, and who is healthy and pre-children, no massive weight loss.
So that kind of gives us a good framework about who those patients are. Talk a little bit about what actually is involved when you're doing liposuction on somebody. Like, how does that process work? Can you do it in the office?
Some surgeons do it in the office. I do not like to do it in the office. I like the controlled environment of the operating room, just because there are complications that can happen with liposuction, and I like to be in the operating room, with the hospital available if God forbid, I need that type of thing post-operatively. But I really keep procedures in the office pretty minimal. It's more comfortable for you. It's more comfortable for me to do things in the operating room. So liposuction, some people do it in the office. I do not do it in the office. To do it, I see beforehand, I mark where we're going to do liposuction, mark out what our game plan is. Liposuction incisions are usually about the width of your pinky finger, about 1 centimeter is what I tell patients. We actually put fluid in. It sounds counterintuitive to take the fat out. The fluid that we put in is called tumescent solution. This helps with a few things. It's got numbing medicine in, so it helps with pain. And the biggest thing for us is it usually has epinephrine in it, which helps with bleeding. It causes vasoconstriction, or your blood vessels to shrink down so you don't have a ton of bleeding during the procedure. Now, depending on the area that we work on, and depending on how much volume, if it's small volume versus large volume, you may have to leave a drain. If it's high volume liposuction, which is usually like 4 to 5 liters or more, I will tend to leave a drain in those patients because they're going to have a lot of swelling and a lot of fluid buildup. But still, most of the time, I'm using it for contouring with my tummy tucks and things. So it's more on the low volume side for me, so I still don't leave drains for those patients. Recovery, you're going to have a lot of swelling. Compression garment. It's huge. Every surgeon uses something a little bit different, but listen to your surgeon and what they recommend. And that's not going to help with the shape. It really just helps with the swelling. The shape is made on table during the surgery, but liposuction swelling, I usually state that about 80% is gone around 3 months, but there's always that last 20% that's going to hover, and it's going to kind of fluctuate off and on for up to a full year. It's going to vary based on, if you eat a salty meal, if you drink alcohol, if you're out in the sun, if you're working out at the gym, you're going to notice some swelling, and it may be a little bit more than usual, and that's still from the surgery. So usually not 100% healed till about that 1 year mark.
How much liposuction, how much fat do you normally take off when you're doing one of these procedures?
So that's going to be very patient dependent and kind of on physical exam, what we feel. I always tell patients when I examine them that I'm going to pinch them a little bit so that I can feel kind of the thickness. And it also depends where the fat's distributed. Some patients come in and they're concerned for liposuction, but really they have something more called visceral fat, or fat that's around the organs, which is internal fat. And that's nothing that we touch with our procedures. That is weight loss, and that's what we encourage for those patients. But the fat that we are working with is, this fat that's below the skin. So it's really going to vary based on physical exam and where everyone carries their fat deposits. Everyone's, you've heard of like pear-shaped, apple-shaped, where everyone carries things.
So the visceral fat is kind of like the beer belly fat.
Yes.
It's kind of like that hard.
Yes.
And versus the liposuction fat, which is like the Dunlop fat.
Yes.
Where your belly Dunlops over your belt. Mm-hmm. That's kind of liposuction fat.
Yeah.
But if you had to say like an average liposuction, you were talking about high volume versus low volume. An average liposuction case, how much fat actually comes off? What is a patient going to see on the scale?
On the scale, nothing. I usually tell patients what we do is contouring work. It's not weight loss surgery. And actually, do not weigh yourself after surgery. You are going to gain weight because of the fluid that you're retaining and the swelling that you have. You shouldn't fixate on the number, because with plastic surgery, it's not numbers, it's contouring. Usually patients, once all the swelling's down and they've healed, they're about the same weight on the scale. But their clothes fit better because we've contoured them, we've taken off extra skin, and we've tightened that diastasis, or we've done the liposuction. So they may actually go down in clothing size without seeing a number change on the scale.
Yeah, I think that's a really important point, because often we'll see patients that come back after having had liposuction disappointed that their weight hasn't really shifted. Mm-hmm. And it really doesn't. I mean, we really don't, on the grand scheme of things. A pound of fat is a humongous. Have you ever seen those kind of cartoons of a pound of fat is humongous?
It is.
So we can make a huge improvement without taking a lot of weight off. Mm-hmm. What about problems? Liposuction is one of those procedures that you hear a lot about complications with. What are some complications of liposuction?
I would say that one of the bigger things we probably see is contour irregularities or lumpy bumpiness. So when you're under the skin, working in that fatty layer, there's actually 2 layers of fat. There's one close to the skin called superficial fat, and then there's deep fat. And really, when you're doing liposuction, you want to be in that deep fatty layer. If you're too close to the skin, that's where you're going to see what we call contour irregularities, lumpy bumpiness after surgery. Other complications, especially if you're doing like ultrasonic liposuction, you can burn the skin because it heats up. So you can actually get burns from that. And I also think with ultrasonic, you can get more contour irregularities because it's very hard to control the distribution of the fat that you're taking out. The scary thing about liposuction is, we are working through, like I said, a 1 centimeter hole, and it's all done by feel on the outside. The scary thing is that cannula can go into the abdomen or into the chest and injure an internal organ. And that can require a hospital stay. It can require a much bigger surgery. And that is something that I do mention to my patients, and I don't think a lot of surgeons mention that. It's extremely rare, but it can happen, and it can happen to the best surgeon. But those are kind of the big things that we see with liposuction. And now fat grafting, that's a whole different conversation, but taking the fat and putting it back in, then there's a whole other set of complications. But that's kind of what we see regularly with liposuction, mainly contour regularities.
And talk about, you mentioned the term cannula, just to make sure everybody knows what that is. Could you explain that for people, what that is?
So the liposuction machine, it's obviously a big suction powered machine. There's 3 main types. There's suction assisted, which I don't really think a lot of surgeons do that anymore, because now we have power assisted, where it kind of does a little bit of the work for you, so it takes some fatigue off the surgeon. Then there's ultrasonic, which is what surgeons say, like, melt the fat because it heats it up. So then the tubing hooks up to the canister, and then you have a hand piece that you're holding, and then attached to the hand piece is a cannula, a long cannula, and there's different sizes that we work with. The smaller the cannula, in my opinion, the higher rate of potentially injuring an internal organ. So with body contouring, I tend to use bigger cannulas. And they're long, skinny tubes that are going in and out like a little vacuum, sucking out the fat and breaking up the fat. So that long tube, even though we're feeling it on the outside, can inadvertently get into the abdomen or into the chest.
Wow. That's
scary. It's scary. It is
That's
scary.
That's right. Liposuction probably is I've had students and people who have been in the operating room who've asked me, what surgery makes me the most nervous?
Yeah.
Liposuction
Absolutely.
is the surgery that makes me the most nervous.
Yes, absolutely. Because to me, it's blind surgery. I like to see what I'm doing, and it's by feel, but that's what we learn in plastic surgery residency and fellowship training. Being a board certified plastic surgeon, we learn how to do it as safe as possible. But again, like I said, it can happen to the best of us. But we learned how to do it as safe as possible, and then being a board certified general surgeon on top of that. And if that were to happen, I know the next steps, what to do afterwards to get you to the hospital to help you, and what can potentially happen with what organ, God forbid, was injured.
Yeah. But I think that the thing for everybody is safety first.
Yes.
To kind of listen to what we're talking about. And the key thing to understand is that we're doing unnecessary surgery. And so safety is obviously the first order of business. Yes. We want to get a great result, but it has to be safe.
Absolutely.
So shifting gears a little bit, talk about the recovery from liposuction. What's that like?
Yeah. So liposuction, actually, even though we're working with small incisions and it's a tiny cannula going in and out and sucking out fat, it's actually one of our more painful surgeries. A lot of patients do have a lot of postoperative pain with this. So we obviously talk about that prior to surgery and steps that we take to help minimize that. The biggest thing that I encourage patients to do after any surgery, even small surgeries, is getting up and walking around. One of the big complications, a big feared complication of any surgery, is obviously getting a blood clot. So when you have a lot of pain, sometimes you're not inclined to get up and walk around a lot, but you really need to get up every hour and a half to 2 hours. It does a few things. It does help prevent blood clots, but it also starts to mobilize that fluid so your body resorbs it and you get rid of it. So it does help bring your swelling down faster. And then the biggest thing I think with liposuction is your postoperative garment. Again, I don't think the garment makes the shape. I think the shape is made on the table. I think the garment is there to help with postoperative swelling and to get that go down faster. And then finally, one thing when I'm doing torso work or big liposuction cases is I recommend lymphatic massage. I think it makes a huge difference in getting that swelling off faster. I think it also helps kind of break up some of the scar tissue that starts to form through those liposuction tracts. I've seen that help a lot with that as well. So those are kind of the 3 big things: is walking, drinking a lot of water along with walking. It sounds counterintuitive, but taking fluid in actually helps get the fluid off. So drink a lot of water, walking, compression garment, lymphatic massage.
And what is a lymphatic massage? You hear people talk about it a lot. Mm-hmm. What is that?
So it's not what people think it is. You think you're going to go in and get this nice, relaxing, deep tissue massage. I've actually had one done by the therapist who I recommend. She's an occupational therapist, and she's wonderful. And it's actually very light, gentle touch on your skin. It's almost as if like you're barely being touched. So the lymphatic vessels kind of sit right under the skin. Lymphatic vessels throughout our body are what drain the bad stuff out of your body. So it drains excess fluid. That's how we find bad things that are going on, because it drains the toxins out of your body. So when she goes in and massages those gentle vessels underneath the skin, she's helped getting the fluids to your lymph node basin, to help get it to your kidneys to get filtered off to leave your body. So that's kind of a general lymphatic massage overview. It's a way more in depth than that, but it's not going to be this deep tissue massage that you go to get relaxing. It is relaxing, but it's not. It's very gentle.
So it's a lot lighter than.
It's very light touch. Yes, it's like feather light touch. I had it done. She helped me when I was doing fertility treatments. I had a lot of swelling and things with the hormones, and she helped me with that. So the fluid comes off fast when you have lymphatic massage.
Interesting. Yeah, I hear it talked about a lot, and we've sent some patients to Lauren, the same person that we both use, but I obviously haven't had it done.
Yes.
Assumed that it was just a kind of your garden variety massage, but it doesn't sound like it is.
It's very, very light touch. I mean, it was so effective when I had it done that I actually got up and used the restroom twice during my session because she was getting the fluid off and I had to pee.
Wow. Okay. There you go. It's just straight from the horse's mouth.
Yes, exactly.
So, well, good. Is there anything else about liposuction that people need to know before they go out and start making phone calls and planning to have their liposuction procedure?
Again, I always encourage patients to see a board certified plastic surgeon because the training that we've had is much more extensive. It's not a weekend course. It's not a 1 month course. I mean, most of us anywhere from 3 years to 6 years and then doing super fellowships after that. I think that makes a big difference because again, if you need skin removed, you need skin removed. It's not just, and I will tell you yes, if you need something done or don't need something done. Whereas I think a lot of other surgeons will just say, yes, lipo's the answer. So I think you want to make sure that and get a second opinion. Go see another surgeon to have somebody make a second recommendation. But seeing somebody who's board certified, I think, is a big, big thing. Obviously, safety is an issue, so you want to make sure that you've read the reviews and know the safety of those surgeons as well. And just make sure you're comfortable with the surgeon that you choose. I think that's a huge thing. This is, like we talk about all the time, this is elective surgery. You don't have to have anything done. So I always tell my patients it doesn't offend me to get a second opinion. You want to make sure you get along with your surgeon. This is the one time where you actually get to pick your surgeon. You don't just get who's on call. So I think it's getting along with your surgeon, picking a safe surgeon, and encouraging board certification.
Yeah, I think those are all great points. So where can people learn more about you?
So I do love social media. I'm not going to lie, I don't love recording it all the time, but I do it for you guys because I know it's fun. My office loves and hates doing it, but I'm mostly on Instagram, so you can find me at Dr. Jessica_Walker. I do also have a TikTok, which is just Dr. Jessica Walker, but everything that's on TikTok is on Instagram. That is me posting, so if you have questions, you can always reach out. Just give me a little bit to respond. And then, obviously, our practice website, which we'll link below, which is usually linked below in our comments and everything. So that's that.
Awesome. Well, Dr. Walker, thank you again. If you guys have any questions, as always, shoot me an email, info@drjasonhall.com. Shoot me a DM at Dr. Jason Hall. We'll put all the links to Dr. Walker's social media handles down below. Thanks a bunch. We'll see you in the next show.